Welcome everyone to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. I'm your host, Kelly Sipin, and I'm so excited to have Nora Witten here with me today. How are you doing?
I'm doing great. Thank you for having me.
Good, good. And you're coming from Functional Physio PT over in Durham, correct?
Yes, that's correct.
Beautiful. So I want to start with just a little bit about you so the listeners can get to know you and have a bit of a background. So can you tell us a little bit about yourself?
Yeah, definitely. So I'm a physical therapist, and prior to becoming a PT, I grew up as an athlete. Gymnastics was my main thing,
Oh,
and as well as
cool.
diving. I did a little bit of cheerleading, so I was just always really active, and knew I wanted to do something with health, exercise. So PT ended up being the best fit for me. So I went to PT school. I went to Duke. I graduated in 2016 and then started practicing. Have been working with mainly active adults. I got into CrossFit while I was in PT school. So really had a passion for working with CrossFitters. And then I started my business in October of 2020. So we're just about to celebrate 4 years,
Oh, so
which is
cool.
super exciting. And we work with CrossFitters, but also specialize in just generally that active adult. And we have two sides, I guess, of the business. So we treat orthopedics, which you would think of when you typically think of PT. So
Mhm.
like hip, back pain, just overuse injuries, neck, shoulder, all of that good stuff. And then I also do pelvic floor PT. So I
Mhm.
work with people who are having issues with leaking, prolapse,
Mhm.
pain, like pelvic pain specifically, which usually there's a hip and low back component to a lot of those diagnoses as
Sure.
well. And then I work with a lot of pregnant and postpartum women. And so I got into that because I felt like there was just a gap kind of in my knowledge of the whole body. So I had some
Sure.
patients that I felt like had pelvic floor issues, but right out of school, I just was like, I'm not really sure what to do. And then started to see a gap in women who were pregnant, having babies, doing CrossFit, and then getting physical therapy. But the pelvic floor PTs they were seeing, I felt like just didn't really understand CrossFit and like what they
Sure.
were trying to do.
Kind of that crossover was
Yeah,
necessary.
yeah, definitely. And so I'm sure they were great PTs. They just didn't have a knowledge of like lifting super heavy or,
Mm.
just doing these like high level things. And so that's really what got me interested in doing the pelvic floor component is okay, I understand these high level activities, running, weightlifting,
Yeah,
and men can have pelvic floor issues too. So I do
sure.
treat some men. So people who have issues with their pelvic floor who maybe go to a therapist that just doesn't really understand how to help them squat or deadlift or run long distances, look at their form. And so that's how I got into doing it.
Yeah.
Love like blending the two. And then it's also nice because I've had some patients who come originally just for low back pain, but then we discover like, oh, you've actually got something going on with your pelvic floor, and so it's nice to be able to just also treat them and not have to refer them to see somebody else.
Yeah, that's absolutely fascinating. I can tell you from my side, on the behavior analysis side, I get a lot of referrals for urinary incontinence
Mm.
in teens and adults,
Mhm.
and finding people who have a pelvic floor background in general, number
Mhm.
one, work with males, because a lot of my referrals are males,
Mm.
number two, and are able to understand like that full body component can be
Mhm.
really, really tough.
Mhm.
It can be very, very tough.
Yeah. Yeah, definitely.
Yeah. So as you're going through your schooling and getting involved with CrossFit, what got you in? Because you said
Mhm.
cheerleading and
Yeah.
gymnastics and that, which there are certainly components, but that really heavy lifting
Mhm.
doesn't sound like it was a part of your growing up.
So it was here and there.
Okay.
Actually, doing gymnastics, the place I went was a YMCA. So we had the gymnastics gym, and then they actually had a regular workout gym on
Hmm.
the upstairs. And so I remember in the summer, sometimes we would have some weightlifting or conditioning stuff that we would do up there. And then as I did diving, I also actually worked out with the swimmers twice a week in the
Sure.
morning. I don't know, it's just crazy. I just liked working out and getting better. And so we did some weightlifting there. So I had some exposure to it. And then I got into CrossFit. Actually, the gym opened up by where I was living and
Mhm.
they had a Groupon, so it was like $50 or something for a month. So I'm like, okay,
Sure.
I'll give it a try. Like I'd started to hear about it. And my roommate actually did it at the time in PT school. And
Hmm.
so, yeah, I started doing it and then actually fell in love with like the heavier weight. So that was
Yeah.
something, like I said, I had a little bit of experience doing, but hadn't done a ton of. And then there also is what they call gymnastics component to CrossFit. So like handstand
Absolutely.
push-ups, pull-ups, handstand walks, stuff like that, that of course I just loved
Yeah.
doing.
Fish to
So
water, ready to
yes.
go.
And there's, a competitive element to CrossFit, right? With yourself and then also with other people.
Mhm.
And I've always been a very competitive person. So it really filled that
Yeah,
competitive need that I had.
absolutely.
Yeah.
Absolutely. I know that there's a beauty to CrossFit and so many people get into it and find their place.
Hmm.
And there's the piece of people who do it till they hurt themselves.
Yes.
And I wonder going in being in PT school,
Hmm.
moving forward and going like, "Oh, I know how to do these
Yes.
movements well, safely, and at high level."
Yeah.
How that's sort of informed your CrossFit experience.
Yeah, so I definitely am not without my own injuries for
Sure,
CrossFit either.
everybody gets hurt.
But yeah, I think, there's actually been research studies showing that CrossFit really is no more dangerous in terms of injury rates
Mm,
than other things, and running included. So you think about
yeah,
how many people go out and just run and, actually don't have anyone watching them. So I think that's the good thing about
that's a very good
CrossFit is
point.
like there is a coach there. Now there's good coaches and bad coaches. So, you could debate that, but at least there's somebody there still guiding you and helping you say like, oh, maybe you should do a little bit less weight for this workout, or um, oh, you have this previous injury, hey, let's modify things, in this way versus running. If you just go, nobody's there to tell you anything. So
That's a really
I
good
think,
point.
yeah, so I think that is something that is actually pretty interesting, is people think CrossFit's super dangerous, but it's actually not.
Yeah. It definitely gets that reputation of being
Yeah,
like, "Oh man, you're just gonna go there till you break your back."
right,
And
right.
that's really interesting, I think, being from the inside, like,
Hmm.
yeah, I've been in these gyms for
Yeah,
years, and yes, I've been a PT for years working with people in these gyms. It's not like a dangerous place.
yeah, yeah.
People don't have to be terrified or
Right.
anything.
And then also when you think about, in PT school, we have to
Mhm.
do clinicals in all different settings. We do them in the hospital, and you just see people who have probably never worked out who are in the hospital
Mm,
with issues, whether that's cardiac or, just anything. And so it's like, okay, if you don't exercise, you're going to end up with problems. So yeah, you might have
sure.
some orthopedic injuries that most of the time can be managed conservatively, right? So like no matter what, something's probably going to happen to you.
Yeah.
And
That's called aging. We all do it.
right. And so I'd say the orthopedic injuries are probably the better if you had to pick, of like being in the hospital for a heart attack, or maybe your back hurts a little bit.
Sure,
Not that I want
sure.
to downplay any injury, because they can definitely be very intrusive on your life. But
Certainly, certainly. So it sounds like when you come in as the PT, you're looking at is it always a post-injury sort of thing, or is there a preventative side or a little bit of both? How does that work in?
most people who come see us usually have something going on.
Mhm.
I have occasionally seen people who don't really have much going on. Maybe they just are a little bit tight somewhere and notice some limitations. So they want to get an assessment to see what they could work on
Mhm.
to make that or keep that from getting worse. But most people who see us usually have been dealing with an injury.
Yeah.
In my practice, we don't really see a lot of people post surgical. Treatment.
Sure.
Most are like overuse injuries. Sometimes they've seen someone else in the past. Maybe it's gotten better, maybe it hasn't. It's returned, and so yeah, it's usually that overuse of like, oh, my knee started hurting maybe a year ago. At first, it didn't seem that bad, but now it's just continued to get worse. And so
Yeah.
figuring out like why is this happening?
That makes a lot of sense. Let's dig a little bit deeper into PT.
Yeah.
What is PT? So we think about like massage usually focuses on
Yeah.
muscles, chiropractors often focus on bones. What is PT?
That's such a good question. I feel
Yeah,
like it's such
sorry. It's a
I'm like,
huge
I wonder
question.
what the actual like definition of physical therapy is. But
Yeah, from
so
your perspective, I
yeah.
should say.
So really I'd say physical therapy is combining movement and hands-on treatment
Mhm,
with a more medical diagnosis, right? So a massage
mhm.
therapist, some techniques that they do we could do, or it could
Sure,
be similar.
absolutely.
Personal trainer, right? They're gonna break down someone's movement pattern and look at it. But we have that knowledge to diagnose things a little bit more. So if
Mhm,
someone comes in and saying my shoulder hurts, so the personal trainer could look at their movement and where they might be limited,
mhm.
but they then don't have that knowledge to go a little bit deeper into like piecing apart like, okay, is it your rotator cuff or your labrum? And to a degree, sometimes that doesn't always, you don't have to know that, but right, but we
Sure.
kind of have that like extra layer of knowledge. And so I'd say that's where the physical therapy is a little different. And then I think we just have also a little bit deeper knowledge on how all parts of the body work together. And some of that
Mm.
comes through a lot of continuing ed. But
Oh, absolutely.
it's like, okay, your hip is hurting, but what is going on at your shoulder, vice versa, and like
Mhm.
just digging deeper into some of those things.
That makes a lot of sense. So it sounds like, 'cause you said you went to Duke.
Mhm.
It sounds like there's a lot of education
Mhm.
behind a PT. What is necessary for someone to call themselves a physical therapist?
So they'd have to graduate from an accredited physical therapy program.
Mhm.
Most are 3 years. There's some that are 3.5, maybe 2.5. There's actually some schools where you could, if you know that's what you want to do, you could go in as a freshman and then apply for what they call a 3+2 program. So you'd get your undergrad and your doctorate all in 5 years versus a
Gotcha.
typical like 4-year undergrad, 3-year PT school. But around that 3 years, and then you have to pass your board exam. So you would take
Mhm.
that usually right after you graduate. Sometimes people can take it a couple weeks before actual graduation, and then you're licensed physical therapist.
Very
And
cool.
then from there, we have to do, at least in North Carolina, about 30 hours every 2 years of continuing education.
Gotcha. So the licensure is state dependent,
Yeah.
as with most licensure.
Yep.
That makes sense. When you got started in creating your own business, what were you hoping to be able to reach in the community? Like who, I know you said CrossFit and especially that crossover with pelvic floor and seeing
Hmm.
those pieces, but was there any like, oh, I need to be a part of opening my own thing, like a trigger point to that?
That's a great question. So I actually never thought I'd open my own business. I never thought I wanted to. I always said that sounds like a lot of work and really stressful. And I was right.
Yeah. Yeah.
It definitely is a
Also,
lot.
as a business owner, I feel
Yeah,
you.
right. So I was right in that. But I had been working at a small clinic,
Mhm,
and it was great as far as the patients that I was seeing.
mhm.
I was treating people that I wanted to be treating, but it just felt like it wasn't really the right fit for me, and I felt like there really wasn't anywhere for me to go career wise.
Mm,
And I knew also always didn't always want to just treat patients all day every
sure.
day. I very much love spreadsheets and computer
You're
work.
talking to a behavior analyst.
Um,
I love me a
yeah.
spreadsheet.
Yeah, and it's just like I'm also introverted, and so
Yeah.
I love talking with people one on one and getting to
Mhm.
know them, but doing that for 40 hours a week is also a lot,
That'll get you.
you know.
Absolutely.
So I knew I was just, I don't know, I just felt like I had these other strengths of things that I could do outside of patient care. And so when I was pregnant with my son, he was due in May of 2020. I just felt like, okay, this isn't maybe the right fit for me. So I'm probably not going to come back after I
Sure.
have him. Didn't know what I was going to do, but had a number of patients ask, are you coming back? I still want to work with you. What are you
Yeah.
doing? And I'm like, like, I don't
From May to
know.
October.
Yeah.
Holy
They,
moly.
and so they were like, well, why don't you just start your own thing? I'm like, yeah, like, I don't know. Maybe. So I thought about it, prayed about it.
Mhm.
The
Mhm.
CrossFit gym I'd been going to, I knew the owner really well. And so he let me sublease space there.
Oh,
And
wonderful.
then I actually got another part-time job doing home health physical therapy with kids, which was hourly.
Mhm.
And then I was a TA at High Point University in their PT program. So I
Yeah.
like had all these, you know what I mean? It wasn't like, okay, this has to work from the beginning. So I was like, all right, I'll
Mhm.
just give it a try. And then I was like, okay, this is what I want to do.
This is the place I
Yeah.
need to be.
Yeah.
How cool. Oh, I love that. So you had that journey of your own pregnancy and
Mhm.
going through that, moving from another business into your own.
Mhm.
How has that been so far besides incredibly stressful and very
Yeah.
exciting at the same time?
Yeah, I mean, it's been great,
Mhm.
and I mean, it's been hard. I think anyone who owns a business
Sure.
knows it's hard. But even just this week, I was like, wow, like I'm doing what I want to do. I am treating 3 days a week right now. I have one physical therapist that works for me in an office manager. And then on Tuesdays and Thursdays, I'll usually do more admin stuff behind the
Yeah.
scenes. And I'm like, oh, this is great, And so even despite it being stressful at times, I've loved it. I've loved the personal growth that I have to have, and especially
Mhm.
hiring employees that has caused me to learn so much about
Yes.
myself and how to manage other people. And, which is painful at times, but I know this is the growth that I was desiring in that old job that I didn't ever see happening.
Yeah.
And I love just learning more about business and advertising and marketing and sales. And like, I just really enjoy learning all of that. And so I love that.
I
I
love
do that.
that. Very cool. So, when we come back from this break, I want to dig a little deeper into what you're doing at Functional Physio PT to make sure that everybody knows what is available. We'll be back in
Perfect.
just a moment. You're listening to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. We'll be right back.
Are you looking for a reliable care service in North Carolina? Do you need a care team that provides passionate and dedicated assistance? If so, look no further than Believer in You LLC. They are a certified state licensed and client-centered care service provider you can surely rely on. Believer in You has served valued clients with respect and dignity for over 5 years. The care team has highly skilled professionals, carefully screened based on their care standards. Rest assured you have chosen the right care with Believer in You LLC. Their mission at Believer in You LLC is to provide excellent, accessible, and around-the-clock care services to their clients, anytime and anywhere. Call today at 888-398-5259 and make sure to head over to their website for more information. That's believerinyou.com.
Families Living Violence Free is Granville County's domestic violence and sexual assault crisis center with a mission of giving voice and support to domestic violence and sexual assault victims. Families Living Violence Free offers a 24/7 domestic violence and sexual assault crisis line, individual supportive counseling for adults and children, customized safety planning and support groups, and so much more. Call 919-693-5700 or para marcar en español 919-690-0888. Visit flvf.org today to see how they can help you or to see how you can support them. That's flvf.org.
When it comes to your health, trust the experts at Granville Health System. We're not just a healthcare provider, we're your partners in wellness. From routine checkups to specialized treatments, we've got you covered. Our compassionate team is dedicated to keeping you and your family healthy and happy. Experience the difference at Granville Health System, where your health is our priority. Call us or visit our website to schedule your appointment today, ghshospital.org. Granville Health System, quality healthcare close to home.
Masonic Home for Children at Oxford is North Carolina's first children's home. Join us on October 12th for homecoming celebration. Fun starts at 10 a.m., including North Carolina's largest shrine parade held this year on campus, barbecue for a donation, free carnival rides, Corey Luchin and the Traveling Blues Band, and more. Join us Friday evening on October 11th for music by Big Time Shine. Visit Masonic Home on their website today. That's mhc-oxford.org or call 919-693-5111 to learn more.
Welcome back to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. I'm your host, Kelly Siphon, and I am very excited to have Nora Witten from Functional Physio PT here with me today. We're going to dig a little bit more into what you're doing at Functional Physical PT. Functional Physio PT. I am renowned for listeners who listen regularly. It's kind of like the where is she going to mess up somebody's name? It's just a thing I do. But looking at that, you mentioned earlier assessments. When you're saying that you do assessments, what does that mean? What are you doing?
So anytime someone comes in, their first session, we call it their evaluation. So that's where we're doing really our big full assessment. And we're always reassessing as we go, of course. But really that first session, what it looks like, we're going to sit down and talk with them just about what's going on. And everyone who comes in has done a phone call with our office manager. So we do have some background information. So that helps us also know what to ask. So we're going to talk to them and you get their goals, why this is important for them to solve, and all the clinically relevant background information that we think we need. And then we're going to watch them do a bunch of movements. So I always have people start standing. I'll watch them, bend over to touch their toes, bend backward, maybe squat, single leg squat. If they're having pain with overhead pressing, I might watch them do that with a barbell or dumbbell. So all kinds of things like that. And then I'm going to dive a little bit deeper when I get them on the treatment table and look at their joints, and I'm going to move them around, see what I feel. Do they have pain? And I'll look at, the first time we don't have time to look at everything, right?
Sure.
But I'm still going to try to look at as much as I can. So even if someone's coming in for their foot, I'm still looking at their knee and their hip, probably their back a little bit, their pelvis, just to get a really good picture of why is this happening. So I'll do all my assessments that I want to do. I feel like a lot of times patients are sometimes what the heck are you looking at? Why are you looking at my neck? Like I'm here.
It's my toe. Why my neck?
Yeah. So I try not to always explain too much as I go, because I don't want. Sure. Sometimes it's better if people don't know what you're looking at, but I'll look at everything and then I sit down with them and lay out, hey, this is exactly what I'm seeing and how I think that relates to the symptoms that you're having, why this maybe started, why it's not getting better. Probably the most common thing that we hear is people will have some injury. They just take some time off. So hey, I'll just, back off from going to the gym for a couple weeks. Their injury gets better, but then it inevitably comes back.
Sure.
So I'll talk them through more of that root cause of saying, hey, look, your hips are pretty tight on both sides, as well as you're lacking some motion in your spine.
Mhm.
And so that's why you took a break. So we removed the stimulus and you felt better, but your hips were still tight and your back was still tight. So that's why then we went
Sure.
back to it. This just came back. So we need to fix these things. So lay that out. I'll typically give them 1 to maybe 3 things that they could start working on at home. So a little bit of homework. We'll go through that and then lay out like, okay, this is how many visits I think you need, how often I think you need to come. And we have a 3-step process that we use, which is reset, reload,
Mhm.
perform. So I'll usually talk them through what that means for them. And the reset is where we're just calming things down,
Sure.
doing more hands-on work, massage, cupping, dry needling,
Mhm.
stuff like
Is that
that.
all available in your office?
Yep. Yep. We do
So
all of that.
cool.
Yeah. And then, also usually that's just working on some basic movement patterns. And then our reload phase is
Mhm.
where we've got that good foundation. So now we can start strengthening and pushing that a little bit more, right? So we want you to move well. And now you're moving
Mhm.
well. So now we want to reinforce that by adding weight or upping the intensity.
Mhm.
And then the perform, this is where we're really increasing the volume, getting them back to doing whatever they were doing at 110% and
Yeah.
making sure that nothing comes up as we go. So if they start to feel a little bit of that pain coming back, like, hey, all right, we're gonna sort of maybe not go all the way back to the drawing board, but reassess and like make sure that they can
Sure.
tolerate this increase in volume and intensity.
It sounds like some of it could be that, hey, I'm going to recognize in myself when pain is here instead of being like, I can work through this.
Yeah.
Like getting that, like, oh, that's a red flag. Let me
Yeah.
pause and reset and talk to somebody who knows what they're doing to make sure that this is moving forward
Yeah,
healthfully.
definitely. I think that's a big piece of that last perform is like we're making sure you know how to manage it too.
Yeah.
I would love to tell people like, yes, you're never going to feel this pain
Yeah.
ever again. Typically, that's not the case. And like I was saying before, if you're active,
Sure.
right, like things are going to pop up, but like we can make sure you have the tools to take care of it before it
Mhm.
becomes an issue so that you can keep doing all this stuff at a high level. And sure, maybe you take one day off, right, but you're not going through that cycle of taking 2 weeks off, going back, and then it hurts again, and then another 2 weeks off. So they,
Yeah.
can manage that
I can
kind of thing.
imagine when you're stuck in that cycle, it could not only ruin your motivation to get back into it at all, but also start you into a cycle of rushing getting back
Mhm.
in.
Mhm.
Like I waited 2 weeks, I got back in, it hurt again. Well, now I don't want to wait another 2 weeks. So I'll wait a
Right.
week and a half. It's fine.
Yeah.
And then you
Yeah.
can get to real injuries, I imagine.
Yeah, definitely.
Yeah.
Definitely.
And then you said at that point, we might be looking at something like surgery, and that could be really much more troublesome.
Yeah, and I mean, I would say usually it has to go on for like a while, right,
Sure.
before we're going to
Sure.
surgery. But we definitely want to help people avoid that at all costs.
Absolutely. Absolutely, yeah. We're not born to be cut into. If we can avoid it, that sounds great.
Yes, yes.
Absolutely. So that's on the assessment side, and you're talking about you mentioned root cause a couple of
Mhm.
times, and you've got functional inside of your name.
Mhm.
So what does that mean for what you're doing?
So with the name functional physio, I
Mhm.
picked that because at the time, and I mean at the time I still am into CrossFit,
Mhm.
and right, so the non-branded name for CrossFit is functional fitness. So
Oh,
I feel
cool.
like people
I've learned
typically,
something new today.
yeah, yes, if you like. Are talking about CrossFit, but can't use the name because it's trademarked.
Sure.
Like functional fitness. So, so people kind of know that, and I think even people who don't do CrossFit specifically, functional fitness of just like kind of lifting and that hit
Mhm.
training is pretty well known. So that's why I wanted to use the name functional because I definitely am more about like getting people up and moving
Mhm.
and lifting weights, whether that's just kettlebells and dumbbells or the barbells, but doing these movements that relate to their function, in everyday life. And
Sure.
then you didn't really ask about this, but I'm just going to tell
No,
you anyways.
please. Follow the
Then,
thought.
then I picked the name physio because in every other country except the US, there are no physical therapists. They're physiotherapists.
Oh,
And so
interesting.
that root word of physio connected to the physiology just
Mhm.
encompasses a little bit more holistic, right? So not just the physical aspects, but your nervous system and, your sleep and nutrition and all of those things.
Yeah. Fascinating. That's a
Yeah.
very deep name.
Yeah.
I like it a lot.
Yeah.
You mentioned HIIT training there. What's HIIT training?
Oh, HIIT, so the high intensity interval training.
Gotcha. Would be the basis of functional
Yeah, that usually
exercise.
goes with functional fitness. So, with CrossFit, right? That's
Functional
most
fitness,
of it
yeah.
is like that high intensity where you're doing something for a shorter period of time, right? And then maybe taking a rest, or maybe that's all you do for that day.
Yeah, very cool. You mentioned dry needling and cupping, and I got
Mhm.
really excited, but I want to make sure that everybody else
Yeah.
knows that too, because it's cool that you have so many different things available in one
Mhm.
office.
Mhm.
So let's start with dry needling.
Yep.
What is that?
Dry needling is a technique that's somewhat similar to acupuncture, but is different. We use a really small filament like needle. It's very similar to an acupuncture needle.
Mhm.
But with dry needling, we are going after trigger points or muscular knots. So I
Mhm.
think everyone knows that, their upper trap or on their neck, great, they got
Sure,
that
and you're
knot that
you're pointing to the space between your neck and your
yes,
shoulder there. Yeah.
that they, will wake up and it's like, oh, it's so tight. So that would be a trigger point.
Mhm.
So you can have those in pretty much any muscle in your body. And so the dry needling, we are finding those trigger points. So we'll palpate or, push around
Mhm.
to find the knot where either it's tender or we can just feel it. Like it just doesn't, it feels kind of ropey is the best way to
Sure.
describe it. So then you'd insert the needle, and there's a couple different techniques that you can do. One is what's called a piston technique. So you move the needle not all the way out, but in and out a little bit,
Mhm.
and you'll feel the muscle twitch. So when you hit that trigger point, the contraction that it's stuck in with that knot, it finishes it. So it has this jump, but then you'll get the muscle to actually relax.
Absolutely fascinating.
Yes. And then typically what I do is I might do a little bit of pistoning, but then actually leave the needle in,
Mhm.
and we'll do multiple needles. So that looks a little bit more like acupuncture, where they would put multiple needles and leave
Sure.
them in. And you don't have to do the piston. That is a little bit more uncomfortable. So sometimes if people are a little bit iffy about the needling, I'll just stick the needle in and leave it, because
Sure.
as the needle sits there, it actually stimulates our parasympathetic nervous system, which is
Mhm.
our rest and digest, compared to our sympathetic, which is the fight or flight. So the needle stimulates that parasympathetic nervous system, where our body can just like relax.
So interesting.
And then there are some other points that correspond a little bit more to acupuncture points. We call them homeostatic neuro trigger points, I guess.
Mhm.
And so those are just spots where the nerves or blood vessels are more likely to potentially get impinged. So sometimes I'll use those as well. So that's what the dry needling is.
Yeah. Yeah, as somebody who worked through a needle phobia, I'm like, the parasympathetic system can be triggered by a needle.
Yes.
Huh.
So yeah, that's why I like to leave them in, because you do get a sympathetic response when you put the
Sure.
needle in. So sometimes people will sweat a lot.
Mhm.
They'll get up and they're like,
Mhm.
"Oh, I just sweated all over your table." And
Yeah.
I'm like, "It's fine. We clean it." So that's why it's just like sometimes you do want to just let them sit there, because
Sure.
then we want
Kind
to
of work through that first response to
yeah,
get the second.
yeah, and definitely for healing, we want more of that parasympathetic response.
Yeah, fascinating. How about cupping?
Cupping. So everyone, I feel like, knows cupping when you talk about Michael Phelps in the
Yeah.
Olympics, however many Olympic cycles ago, right? He had all those red
Sure.
dots. So the technical term is called myofascial decompression.
Mhm.
So when you think about our fascia, I can just explain that really quick.
Please.
Basically, it's just a covering on everything in our body,
Mhm.
essentially. But it does move and glide, and it should just kind of move with us. But sometimes that fascia can get stuck to the muscle or organs where it doesn't move with us. You can
Mhm.
think of it as almost like a plastic wrap kind of, but it shouldn't
Sure.
restrict us. So with the cupping, you can do the where you suck it out.
Mhm.
So there's a little gun, but you suck the air out.
So it's literally like a little cup
Yep.
shaped device.
Yep.
Mhm.
You can do cupping with fire. I don't do that in my office.
Sure.
Where you
Sure.
would put a flame in the cup and then really quickly stick it on
To create that
to create the
suction.
suction.
Mhm.
Yeah. I have had that done actually in the acupuncturist office, which feels good because it's really warm and
Yeah.
nice, but no fire in at functional
Totally
physio.
fair.
And then I
You
have
heard it here first, folks.
yeah. And then I have another type of cupping that are just silicone cups. So you'll
Mhm.
just squeeze it, you stick it on and squeeze it, and then it creates a suction.
Gotcha.
So by creating that suction on the skin, we're stimulating that area to increase blood flow. And I don't believe that we can really break up things, right? Like our
Mhm.
body is pretty resilient. So I don't know that we're truly pulling the fascia away, but by at least we're at least pulling up on the skin, right? Because you can see it and then
Sure,
pulling blood flow to that
absolutely.
area. So I do think you can certainly see a change. And I think even just that stimulation, right, also has an effect on our nervous system to help let things go.
Mhm.
So with the cupping, there's a couple different techniques you can do. You could put multiple cups on and just let them sit. You could move the cups around. So that's what I like to do a lot, actually, is I'll
Mm.
put some massage cream or lotion on the client, and then I would put the cup on either the plastic or the silicone one, and then you can glide it over their skin.
Sure.
And that can be helpful because you can also usually find places where it doesn't glide as well, where it is tighter, where we do have some
Mm.
restrictions in the fascia. And so you could just work in that area. And then another way is to put all the cups on, but have the client actually do some movement. So I've done this before with people, especially for shoulders. I'll put the cups around the shoulder and then
Mhm.
have them do movements with their arms. So maybe lifting overhead 15 times, reaching across their body 15 times.
Mhm.
And I really like that as well, because again, the muscles are actually working and moving, right? And then,
Yeah.
but we have this suction on them. And so then you get a little more of that blood flow and pull
Sure.
on the
And I
skin.
imagine a bit of a stretch.
Yeah,
Yeah.
definitely.
It
Definitely.
sounds like something to do with the right person. Like,
Yeah.
you don't just be like, I'm going to buy these cups and I'm going to move with them on.
Yeah. I mean, they're pretty safe. So sometimes
Yeah.
I will recommend patients get them at home. I mean, the silicone
Well,
ones.
they've been
Yeah.
working with you. So
Right.
they
And
know
I
how to use
can,
them responsibly
yes,
and well.
yes. I would say, I mean, obviously, I'm, like dry needling, right? Like I'm not telling people to do that,
Sure.
do that at home,
Sure.
but yeah, the cupping is pretty safe. And so it can be really good, especially a lot of clients that I have who've had C-sections, having
Mm,
them cup either on the scar or around it can be really
that's so
helpful.
interesting.
And usually clients who don't want to touch their scar feel a little more comfortable doing the cupping. And so that can be a really good way for
Yeah.
them to work on it. But yeah, other things, if their, quad is tight,
Mhm.
or on the knee, they can buy them and do it at home too.
Yeah. Do you mind if we lean into that, the not wanting to touch the scar?
Yeah, yeah.
So that's such an interesting thing because I think when we think about PT, physical,
Mhm.
but then the physio side, like you said it, there's so
Mhm.
much more to it. And that piece of this changing my body or this injury
Mhm.
or this surgery or whatever it might be has created something that I may have trouble interacting with,
Yeah.
such as a C-section
Yeah.
scar. How does that inform what you do and come into your practice?
Yeah. Yeah, it's such a huge piece, and I'm never going to make someone do something that they don't want to do.
Love that.
And so sometimes people in the hospital are told, "Oh, you should work on the scar, massage it. That's good for the scar tissue and
Mhm.
reorganization," which is totally true. Sometimes people don't get told that, which is kind of annoying, but I guess that's why I have a
Sure.
job doing that. That's my role. So if people haven't told that, I'll ask them, "Oh, have you done it?" And sometimes they might say no, like it just freaks me out. I don't want to
Mm.
touch it. And I'm like, okay, that's totally fine. You don't have to touch it. So then usually I'll ask, like, would you feel comfortable just massaging your lower belly, like over your leggings, or shorts,
Mhm.
like just touching it
Mhm.
there? And sometimes they're like, yeah, I think I could do that.
Sure.
And so I'm like, okay, great. And then I've also had people ask, well, like, is it really important to do this? And I'm like, yeah, it is. It is helpful to massage your scar, but if you don't feel comfortable touching it, or, this was a really traumatic birth experience for you and touching that brings
Mm.
it back, like that's also okay. Like you're not
Yeah.
gonna if the scar tissue is not gonna be so bad that like it's worth, making you
Yeah.
go through that. So yeah, it is super interesting. And I had one client that so we can do dry needling actually on scars too. I
Mhm.
didn't mention that. So she had a C-section and hadn't really talked about it much. I asked her, "How do you feel about your birth experience?" And she was
Mhm.
like, "Well, it's fine. I mean, whatever." She just didn't say too much. And so I was like, "Okay." And so she had been having some pain around her scar, and this
Mhm.
was after I'd been treating her for at least a couple months. So scar
Yeah.
was still a little tender, and I was like, "Well, do you want to try some dry needling on it?" And
Mhm.
she was like, "Okay, I'll do that." So started dry needling it, and then she just started crying, like just crying.
Mm.
And I'm like, "Hey,
Yeah.
just cry,
Are
just
we
let it
good?
out,"
Yep.
but making sure she was okay. And
Yeah.
she was like, "Yeah, just this just kind of brought back like being in the hospital and just having this area touched and everything."
Yeah.
And I was like, "Yeah, like." That makes sense. And, I was like, "Do you want me to take the needles out or leave them?" And she was like, "No, you can leave them for now." And in one of my courses that I took, the instructor is very much into energy and
Sure.
trauma healing and all of that stuff. And so she's like, if your clients ever crying, she was like, do not hand them the tissue box. She's like, that's signaling them to stop. And she's
Yep.
like, they need to cry.
Yeah.
So, which is always really hard. I feel like rude, not offering
Sure.
someone a
When
tissue,
somebody
but
asks for it, give it.
yeah,
But until then,
yeah.
yeah,
And
I
so,
totally agree.
so I was trying to be like, hey, like, you can cry. You are not the only person that cries in my office. Like, you just let out whatever you need to let out. And
Yeah.
so anyway, so that happened. And then the next time she came back and she was like, yeah, like, I actually feel a little bit better as far as my scar and pain and stuff. And she's like, that was kind of weird. Like, like how that happened. And I was like, yeah, I think that was really therapeutic. Not in the way we originally thought it would be, but
Sure.
just, actually like laying out some of that trauma and emotion. So it's just crazy what the body can hang on to. And sometimes we don't
Yeah.
even realize it until, something triggers that.
Absolutely. Absolutely. Oh, that is so, so cool. That's such a good place for us to pause. I'm going to go ahead and pause there for a moment and we can get a little deeper in some of the other things that you're doing at Functional Physio PT on the other side of this break. You are listening to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, the Nextdoor Radio app. We'll be right back.
This was my first massage. Tracy walked me through the entire process. It made me feel comfortable as possible. We had a delightful conversation and our studio was beautiful. I will definitely be returning for another massage very soon. This is a direct quote from a review from the Whole World Massage located at 3509 Haworth Drive, Suite 205 in Raleigh. At Whole World Massage and Med Spa, our focus is you. We love working every day with people like you, helping them look, feel, and perform with youthful energy and beauty in mind and body. Call today to see how Tracy can help you feel great today. 252-213-4478. 252-213-4478. Better skills mean better jobs. Are you seeking short-term training that empowers you to jumpstart or advance your career? Do you want a hands-on training for an in-demand job in a field such as healthcare, law enforcement, skilled trades, or trucking? Let Vance Granville Community College help. Vance Granville's short-term continuing education programs equipped with the skills you need for fulfilling a new career. Visit vgcc.edu/coned. That's CONED or call 252-738-3400. Vance Granville Community College, your community, your college. Now's the best time of year to get more for your money on new Mahindras. Enjoy 0% interest or save thousands of dollars on rugged Mahindra tractors. That's more for less on many of Mahindra's best-selling models with tractors that deliver more lift capacity, fuel efficiency, and built-in weight. Save more on Mahindra today. Visit Vanco Outdoor Equipment, your local Mahindra tractor dealer. 0% APR. Financing available for limited time only. See us or go to MahindraUSA.com for more information. The Hub on Main, located at historic downtown Oxford, has something for everyone. And I mean everyone. Brewmate, mud pie, Tyler candles, craft beer and fine wine, gifts for the loved ones, coffee, cigars. See what I mean? The Hub on Main is your one-stop shop for all things you love. The Hub on Main is located at 100 Main Street in Oxford. They're open Monday through Sunday. Check out the Hub on Main on Facebook to check out specials, classes, meetups, and more. The Hub on Main. Stop by today.
Welcome back to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. I'm here with Nora Witten of Functional Physio PT. I want to dig into the other side of what you talked about earlier. So you said we really work on the orthopedic side, and then we started to get into a lot of things that happen around pregnancy and postpartum. Tell me more about pelvic floor PT. That is such an incredible thing that I know a lot about because I happen to have the crossover, but not everybody knows what that is, what's available. So what is a pelvic floor PT doing?
So pelvic floor PT, just in general, is a subspecialty of physical therapy. Even within pelvic floor PT, there are even more subspecialties.
Yes.
So there are people who just do pediatric pelvic floor PT. There are people who would maybe specialize more in chronic pelvic pain or even in men's pelvic floor PT. It's like all kinds of things. So really, I say it's helping people with pee, poop, and sex is like
there you go.
the most basic
I love
thing.
how forward you are.
Yeah.
Because that's how we talk about the real stuff.
Yes.
Yep.
So what I really specialize in, as I already alluded to, is that pregnancy and postpartum.
Yes.
So either people who don't really have issues but want to just keep exercising during pregnancy, prepare for birth, and then same thing postpartum, get back to it, or people who are having pain or issues around pregnancy or birth, postpartum things. So a lot of what I'm treating is stress incontinence, so leaking with exercise, coughing, sneezing, prolapse. So that's when you get a descent of your pelvic organs. And so people usually have symptoms more along the lines of like vaginal bulging or pressure, things like that. And then, like I said, just that pregnancy, postpartum wellness things as well too.
Yeah. So cool. Sorry, I think I cut you off there.
Oh, no, that's fine. I didn't have another thought. So
perfect.
Whatever your next question is.
So looking at pelvic floor PT and all those different specialties, you said you really got into how do we make sure that people are able to maintain what they want to do, able to breathe
Mhm.
almost sometimes
Yeah.
quite literally without having these symptoms come
Mhm.
up. What does an assessment for pelvic floor PT look like?
So I'm always going to start the same as far as talking to the
Mhm.
client about what's going on. And then I'll look at similar stuff, just like I talked about standing or moving, doing whatever things they have issues with. And especially the big thing is like running or lifting. So if somebody is
Mm,
leaking while they're running, and I may not always get to this on the first visit, but I want to watch them run
sure.
because that's when they're having their symptoms. So, are they doing a poor pattern with how their foot is striking? Are they really weak in their hips? Do they not have enough movement in their trunk? And could that be causing their symptoms?
Mhm.
And then to do a actual pelvic floor assessment, we would do this vaginally or rectally.
Sure.
And so we do this with gloves and are really just assessing usually one or two fingers of like, what does their pelvic floor feel like? So I'll have them do this
Mm,
laying down. And it's not like the gynecologist where we have stirrups and things like that.
sure.
So they're just laying down on their back on their table or on the table. And so I might have them do some Kegels, which would be contracting and relaxing their pelvic
Sure.
floor. However,
Sure.
that's definitely not always the whole story. So,
Mhm.
I was just to like to look at what they can do and then also do an internal assessment standing. So again,
Mm,
vaginally or rectally, I'll have them stand, just do some breathing, some coughs, some Kegels, stand on one leg, try to do a Kegel. I'll have them squat. Sometimes I've had people hold a dumbbell and squat and see like what's going on with your pelvic floor while you're doing these
yeah,
dynamic activities. And so that can always give us a lot more information too, again, because if someone's leaking, typically they're not leaking when they're laying down on their back at night,
that's a very good point.
So we want to try to replicate that activity as close as possible and
Mhm.
get that information. And that's something that we don't have to do. So if somebody doesn't feel comfortable with it, I'm never going to make them do an internal
Absolutely.
assessment if they don't want to. But it does give us a lot of information. So most of the time people are okay with that. And then
Mhm.
sometimes we might need to do internal treatment. So if those muscles are actually really tight, then we can do some work to help release them,
Mhm.
even changing their hip position. So I might actually kind of work on someone's hip while also working on their pelvic floor.
Sure.
So we'll do things like that. We can actually do dry needling to the pelvic floor too.
Fascinating. You're teaching
um,
me so much
yeah,
today.
which can be really helpful and like
Yeah.
really, really life changing for some people.
Huh.
So yeah, so we'll do all that kinds of stuff. But then some of the treatments look similar to like just regular like orthopedic PT. So I'm a big believer, as you can already tell, in lifting and getting people strong. And I think that's an
Absolutely.
area that sometimes a lot of traditional pelvic floor PT is missing. And maybe just because the clinic doesn't have those heavier weights or the PT
Sure.
just they don't have the training in it themselves. So of course they're not going to feel comfortable teaching somebody else to do it. But like for instance, I had another woman who was leaking with deadlifts, but only after like 200 pounds, right? So like pretty
Yeah.
heavy. And
Yeah.
so
Not
for,
messing around sort
yeah,
of deadlifts.
yeah.
Yeah.
So for her, her pelvic floor was like really strong if I just had her do a Kegel,
Mhm.
but I didn't do an internal assessment with her lifting 200 pounds, although that would have been curious to see what happened.
Sure.
But
Sure.
for her, it was actually a lot of lower abdominal work, deadlift form,
Mm.
lats, so the big muscles on your back, like a lot of
Mhm.
actually stuff working on that because we needed to make sure her form was right. And like, okay, when you're lifting that much weight, is something else kicking in, or are you not engaging in the way you should, and that's putting pressure down on your pelvic floor. So
Yeah.
yeah, we'll do a lot of stuff like that too, just depending on what's going on with them.
Absolutely fascinating. There's so many different services in this area that people just don't know are available
Mm-hmm.
and ways to improve your life. Like, oh, this is something that just everybody deals with.
Yeah,
Oh, everybody has pain
right.
here. Or, you hear the joke after someone has a baby, like, of
Mm-hmm.
course I pee when I sneeze. And that doesn't have to be the
Exactly,
norm.
exactly.
Yeah. And that's really cool that you've taken that piece of, yes, we have providers that work on just that.
Mm-hmm.
And do you want to be a top level athlete?
Yeah.
Because if you do, we're going to need both those pieces there.
Yes, definitely.
That is so cool. So, looking at PT in general, pelvic floor PT in general, same as behavior analysis, often it's covered by insurance. If you got the right codes and you
Mm-hmm.
jump through all the loops, it can be covered by insurance.
Mm-hmm.
I will tell the listeners over and over again that I don't take insurance
Mm-hmm.
for a number of reasons. For functional physio PT, do y'all
Mm-hmm.
take insurance?
We do not. So we are
Tell me about it.
completely out of network.
Mhm.
So our clients would just pay us directly.
Mhm.
And we do this because insurance puts a lot of limitations on what you can
Yes.
or can't treat.
Mhm.
And also what they reimburse is pretty low. And
Mhm.
so that's why at a lot of clinics you'll be seen or if you're a patient, you're going to be seen with at the same time as another patient. So the PTs could be seeing up to 4 people an hour, and so you're
Yeah.
not getting good care if there's one PT to 4 clients. You just can't give good care that
Yeah.
way. And then also with the reimbursement codes, some are reimbursed higher than others, and so there can be a push to bill sometimes unethically to get those
Mm.
higher reimbursed codes or give clients treatment such as like heat or ice or just put them on a bike for 8 minutes so that way we can reimburse for that. And
Yeah.
so when a PT has to think about, okay, what treatment am I going to do? Can I code this in the way that my clinic wants me to? That just takes
Yeah.
away from the patient. And so we just get rid of all of that. And we're like, hey, we're going to give you whatever you need. And we do give clients what's called a super bill. So if they want to submit it to their insurance, it has everything they need on there to potentially
Absolutely.
get reimbursed. So we do offer that.
Awesome. Awesome. And you may have also heard of this as an itemized receipt, some
Hmm.
people will call it. Looking at that piece of being able to individualize. And that's something, one of the reasons that I don't take insurance either,
Hmm.
because insurance was able to say, yeah, the family really wants this or the patient really wants that. But I, random insurance company,
Hmm.
don't find that that is socially significant. And I'm going, no, you don't understand. This is the
Yeah.
most important thing to this person and
Yeah.
something we can help on. Why can't we focus on it? So, what's the situation? And take your time
Hmm.
thinking about this that you've run into and gone, holy moly, if I took insurance, I may not have been able to help this person. Or there was a way I was able to individualize for this person that I'm just like,
Hmm.
thank goodness that they came and they got exactly what they needed and wanted
Hmm.
because they had the say as
Hmm.
the patient as
Hmm.
to what they needed, what they wanted, what they were willing to do, and you had the say as the
Hmm.
professional to go, this is everything that's available. You are fully informed and there's nothing
Hmm.
blocking you.
Hmm. So I had one client come who initially came for shoulder, but she said she also had some pelvic floor issues.
Mhm.
And she was like, I just wanted to find somewhere where both of these could be treated by the same person. And I'm
Mhm.
like, you're in the right place. And so sometimes, especially depending on the type of insurance, you can't treat someone for more than one body part under the same plan of care.
Oh,
I know,
insurance.
even
You
if those
cutie.
things are, like, actually related. So
Yeah.
if she came in for her shoulder, I may not have been able to do anything on her pelvic floor.
Mhm.
If insurance was like, "No, this is a shoulder plan of care," you would have to essentially, like, go see another provider, open a new one, just things like that,
Yeah.
can be super annoying.
Yeah, of course, behavior analysis
Mhm.
and PT are different in that way. That piece of I never would have thought, oh yeah, if you're working on a shoulder, you can't work on a
Mhm.
wrist, on pelvic floor,
Mhm.
on a big toe,
Yeah.
whatever it might be. That would be a block. And like you said earlier, the functional side,
Mhm. Everything's
everything.
connected, yes.
Yeah, I can imagine that would be incredibly limiting to patient progress.
Mhm.
If you're
Mhm.
only able to, they're like, okay, you came in for wrist. That's
Right.
all we're getting.
Yeah. Yeah.
Yeah,
Definitely.
absolutely fascinating. I want to lean back into the pelvic floor side of things. You said that men, women, all
Mhm.
sorts of people can be treated for this. Is there anything, if we're listening right now and going, oh, this is something that I'm interested in or concerned about, is there anything that we can do generally to have a healthier pelvic floor or
Mhm.
to maintain health of that part of our body?
Yeah, great question. So I think starting with just some general good bowel and bladder habits
Hmm.
can be a great place to start. So if you don't have a squatty potty already, I would highly suggest one.
And
If
that would be to raise
the
your feet.
yep.
Hmm.
So a little stool that goes under your toilet. So when you're in a squat position with your knees higher than your hips, your
Hmm.
pelvic floor can relax, and that's what we want to happen when we're peeing or pooping. We need our pelvic floor to just let
Hmm.
go, so we can have easy passage of those things. So doing that, and then just making sure that you are on a good voiding schedule for your bladder. So
Hmm.
normal emptying is about every 2 to 4 hours.
Hmm.
Yes, even if you drink a lot of water.
Yeah.
And you should feel fully empty when you do go to the bathroom. So if you pee and then you get back up and in like 20 minutes, you're like, ooh, I just like really feel like I have to go to the bathroom again, or like I just didn't get it all out. That's not a good sign. So the squatty
Oh,
potty can help with that.
interesting. On the
And
urinary side.
yep.
People don't talk about it on the urinary
I know,
side.
right? Yeah, they think about it mostly
Yeah.
just for pooping, and the same goes true for pooping. If you like, go to the bathroom and then 20 minutes later you're like, oh, I have to go again, right? Like you probably didn't get it all out. So,
Sure.
um, sometimes just sitting on the toilet a little bit longer, trying to just relax, like do some deep breathing. They say not to have your phone in the bathroom, especially if you're looking at news or something, right? Probably makes you a little more
Don't get all
stressed
stressed.
out. And then, so going back to like the avoiding the every 2 to 4 hours and just trying to avoid what we call just in case piece. So that's like, oh, I'm leaving the house. I better go just in case.
Interesting. Why do you avoid that?
So that's because if you are frequently emptying your bladder before it's fully full,
Mhm.
it really rewires your brain to then, when it senses your bladder's half full, to say, okay, I need to go to the bathroom. And so then if we're like, we can get to the problem where we're just constantly having to pee or like go
Sure.
to the bathroom. And so if that's you don't have to go from like going every hour to every 4 hours because that can be anxiety
Sure.
producing. But maybe just say, okay, I'm leaving the house, but I did just go to the bathroom 30 minutes or an hour ago, so I'm gonna wait, and when I get where I'm going, if I have to pee, like I'll go. So just trying to start spacing bathroom trips out. The exceptions would be like a long car ride, or if you do have some meeting that is going to be like 2 to 3 hours and you can't get up. Like there's times like that where it's fine, and then before bed at night. So trying to make sure we're on a good schedule there. Of course, if you have coffee or alcohol, things like that, that does irritate your bladder. So
Sure.
if
It's going to change your schedule during that time.
It's that's okay. But also, if you're going to the bathroom all day, every day, maybe you need to cut out some caffeine or sparkling water, things like that are bladder irritants.
Interesting. So sparkling water in particular is
it's the carbonation.
Yeah. How fascinating. I'm telling you, I'm absolutely loving everything that I'm learning today. It's so cool how many things are connected and how many things like, oh yeah, this is for that, but it also helps with this, this, and this.
Yeah.
Might as well think about it.
Yeah.
Well, we're going to take a quick break, but we'll be back in just a moment. Everyone, you are listening to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. We'll be right back.
It's time for you to visit Tobacco Wood Brewing Company with 2 great locations for the perfect award-winning brew and great foods such as chicken and waffles, tacos, barbecue plates, house salads, nachos, wings. That's just mentioning a few of the great items in Oxford at 117 Wall Street and in Durham at 2500 Mediterranean Parkway. Did I mention award-winning beer, the Kilted Eddie, Liquid Luck, Rocket Surgery, the Moose, and the Porter Express? Again, I'm just mentioning my favorites. Find your favorite brew mixed with a great atmosphere and great food at Tobacco Wood Brewing Company today. 2 great locations in Oxford and in Durham. Tobacco Wood Brewing Company is veteran-owned and operated.
Oliver's Towing and Recovery is a family-owned and operated local business since 1965. This local family business does towing and recovery in and surrounding areas of Granville County. Oliver's Towing and Recovery also does jump starts, lockouts, tire changes, fuel delivery, local and long-distance tows, and medium and heavy-duty towing. Call today if you need a pick-me-up from Oliver's Towing and Recovery at 919-693-2520. That's 919-693-2520, or find them online at oliverstowingllc.com. There's nothing too big or too small for Oliver's Towing and Recovery.
PlumbServe LLC technicians have over 20 years of experience in plumbing repair and services. They pride themselves in being a local, honest, and professional company. Let them give you a quote today on those needed upgrades in your home. Your choice for plumbing in Creedmoor, Oxford, Henderson, Durham, Raleigh, Chapel Hill, Cary, Apex, Stem, Garner, and the greater Triangle area. Visit their website today to schedule. You can contact them there as well. PlumbServeLLC.com. Again, that's PlumbServeLLC.com.
Welcome back, everyone, to the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. We are wrapping up with Nora Witten of Functional Physio PT. Now, where I want to start in this last section is how do people get a hold of you? What are the best ways to follow you, to find you, to get in contact?
Our website is just www.functionalphysiopt.com, and physio is spelled with a Z, so PHYZIO. So just make sure of that. And then you can also find us on Instagram or just at Functional Physio, or you could call us. It's our phone number is 919-705-0701. Welcome to text us as well, too. We do a lot of texting, actually. So those are all the best ways to get in contact with us.
Awesome. And you're located in Durham. Can you give the address there?
It's 2828 Pickett Road, and we are near the Target and Sam's. That's off of 15501.
Oh, perfect.
Just off there a little bit.
Yeah, fantastic. As we're starting to wrap up, is there anything that you want to leave the listeners with today? Either something that you hope somebody hears or that, you really want to reiterate?
I think just that we are really different than your traditional PT clinics.
Hmm.
And I know paying out of pocket can be a barrier a lot of times for people to even come give us a try. And I
Mm,
totally understand. And I think that sometimes they just don't really understand the difference, especially if they've never been to
sure.
PT before, then they may not really know what it's like if you go to just a big, corporate private practice or hospital system versus coming to see us.
Hmm.
And I just want to say you're also not alone in that. We've had a lot of clients who have ended up working with us that have ultimately said, like, oh, I was really nervous to pay out of pocket initially, but this has been so worth it to do.
Yeah.
And so I think if you're on the fence, I would just encourage people to give us a call. They can talk to our front desk and just learn a little bit more. And even just coming in for that first session just to, see and like experience the difference for themselves.
I love that. What are the people that you're really hoping to reach today? Some of the folks that you hoping really hear the message.
I think anyone who is active and just has some kind of sport or activity that they love doing that they feel limited by because of an injury. So whether that
Sure.
is CrossFit or running, pickleball,
Yeah.
as that's becoming a growing sport, that's the people that we want to work with, the people who are motivated to continue being active and do their sport or activity of choice and, just don't want to be held back by pain or symptoms.
I love it. Thank you so much for joining me today. I know this last section, everyone is like, oh, we want to hear more. It's always a short section because there's so many amazing things that we get to talk about throughout our time together. I'm so excited that we got you out here, Nora, and that we got to talk about everything that you do. Can you give us your website and your Instagram handle again, just to make sure that everybody got that?
Yes. So website is functionalphysiopt.com and Instagram is just at functionalphysio.
Perfect. And if y'all are not following already on Instagram, it's a great page with a lot
Thank
of
you.
really, really good information. Thank you, everyone, for listening in today. This is the Helpers Hour on Nextdoor Radio, nextdoorradio.com, and the Nextdoor Radio app. I'm your host, Kelly Siphon, and I look forward to seeing you next time.